Disclaimer, this is a student presentation using a hypothetical scenario for educational purposes. The presenter is a student at UAMS, not a representative of the agency named in the following slides. The information contained herein does not necessarily reflect the views of said agency. Hello everyone, my name is Tyresha Price. I am an occupational health consultant here to inform you all on mold. You have recently bought a house and decided to flip it for a profit. Mold is often an issue in these flipped houses and one that may or may not be taken into consideration. My aim is to change that. Here is an outline of my presentation. First, I will begin with an overview of mold, which will include what exactly is mold, why is it growing, and how to identify it. Next will be hazards associated with mold. In this section, I will discuss routes of exposure and health issues caused by mold. Following that will be mold prevention and then mold removal and remediation, then regulations regarding mold. Okay, so mold are fungi that are found virtually everywhere. Mold is a natural part of an environment whose role is to break down dead organic material. They reproduce by spores, which are tiny and invisible to the naked eye. Spores travel through the air and they are highly resistant. They survive dry and unfavorable conditions and can survive for a long time in these conditions. Mold needs moisture to grow and usually grows indoors as a result of spores landing on something wet. Identifying mold in your home is pretty simple and straightforward. You can use your senses. Stating the obvious, if you see mold, you have mold. A visual inspection is the most important step to identifying a possible mold problem. Mold typically looks like discoloration. More often than not, it will be black, gray, green, or brown, but can be other colors. Another way to tell if you have a mold issue is if you smell mold. Smelling mold but not seeing mold could indicate a hidden mold problem. Possible locations of hidden mold could be the backside of drywall, wallpaper or paneling, under carpet, inside the walls, around leaking pipes, in the ceiling, and so on. If you suspect hidden mold, you may need equipment to verify that mold is present. So, sampling for mold, for the most part, is unnecessary. Again, if you see mold, then you have mold. And if you see mold, it should be removed and remediated regardless of what kind of mold it is or how much mold you have. It has to be fixed. Sampling would not really affect decisions on how to remediate for mold or how to handle waste. Furthermore, there aren't that many standards for mold to say whether or not an acceptable or unacceptable amount of mold is present. So, some of the routes of exposure for mold are ingestion, skin contact, and inhalation. For your purpose of flipping a house, uh, skin contact and inhalation are the most important. The most important mechanism of exposure would be inhalation. Inhalation of mold usually happens by aerosolization of mold. And in the simplest way of defining it, aerosolization of mold happens when mold spores are carried through the air. Mold aerosolization can happen when contaminated materials are moved or if the HVAC is contaminated. Let's see. Mold produces allergens, irritants, and mycotoxins. Mycotoxins are potentially toxic, but not always. In general, mold does not have much effect on healthy people, but people can become sensitized. This means upon the first exposure of mold, nothing happens. Subsequent exposures to mold may produce symptoms though. These symptoms are usually allergic in nature, and include hay fever type symptoms. So think sneezing, runny nose, skin rash, and itchy eyes. Mold can cause infections, but in general do not cause systemic infection except in at-risk group. So who are the at-risk groups? Well, the at risk are the immunocompromised and immunosuppressed. Think people who are on immunosuppressive drugs, cancer patients, and those who live with HIV and AIDS, for example. The at-risk group can also include those with uncontrolled diabetes, people with existing respiratory conditions, infants and young kids, and the elderly. The most important point of this presentation is the key to preventing mold is moisture control. If nothing is wet, mold is unlikely to grow. Some suggestions are to fix the humidity in the house, preferably to 30 to 60%. Um, Fix any leaks that may be present, and that could be, things obvious like a leaking faucet or something not so obvious like a pipe hidden behind a wall. Make sure the ground slopes away from the house foundation so water does not enter or collect around the foundation. Also inspect your HVAC and make sure the drip plans are clean and there's no back flow in the pipes. A good rule of thumb when assessing whether or not you can handle the mold problem yourself is to assess the size and scope of the mold problem. If there is less than 10 square feet of mold, you can do it yourself. If there is more than 10 square feet of mold, you might want to consider a professional team. You also might want to consider a professional team if the HVAC has been contaminated or the damage was caused by wastewater or sewage, or the damage was caused by water that might have been contaminated, such as with asbestos. Also, if you have health concerns, like you're a part of the at-risk groups, you should consider hiring a professional team. And if there are physical hazard present, such as electrical hazard, consider hiring a professional team. If you choose to do the remediation yourself, you will need basic personal protective equipment or PPE. So you will need goggles to prevent mold or mold spores from getting in your eyes. You will need gloves to avoid touching mold or moldy items with your bare hands. Long gloves that go to the middle of your forearm are recommended. Respirator masks to avoid breathing in mold or mold spores. Consider an N95 respirator, which is available at many hardware stores. You may have to get fit tested for one. Remediation equipment. So here are a list of some, not all, remediation equipment that you could use to help remediate the mold. So you can get a borescope, which is used to look for hidden mold, mold behind walls, behind furniture, or even in the ductwork. You can use a moisture meter to see if items are completely dry. Let's see, biocides. Okay. Biocides aren't really recommended because even though the mold is technically dead, the components that can cause health issues are still there. Okay. And here are just a few remediation tips. Fix leaks and other problems immediately. Um, Mold tends to grow if water has, or if something has been wet for more than 48 hours. So the quicker you get it dried and clean, the less likely you will have mold growing. Let's see. Mold can be removed off hard surfaces. Absorbent material or porous material can be discarded. Think things like carpet or ceiling tiles. So mold can grow on or fill in crevices of these materials. This makes mold removal difficult or impossible. Furthermore, wear PPE. Do not paint or caulk over mold. Whether or not remediation has been completed is ultimately a judgment call. In general, if you don't see mold or you don't smell mold, you probably don't have mold. Um, if you complete remediation and then you go back and revisit the site and you don't see any signs of water damage or mold growth, you can consider remediation completed. Okay. So, regulations. There are no set federal limit for mold or mold spores. There's no standardized methods to measure the magnitude of exposure to mold. There's no state or federal regulation or laws requiring mold to be remediated. This makes it hard to assess how mold has affected someone's health or whether or not remediation is successful. Also, because there are no regulations, this is something to keep in mind when buying and selling houses. If you buy a house with potential mold damage, this is something you will have to take on and fix. If you try to sell a house with mold damage, it likely won't go for the best price. Either way, this is something that you have to take into consideration. In summary, mold is a naturally occurring fungi that can potentially cause structural damage and human health issues. Moisture control is the most important in mold prevention. The goal of remediation is to remove the mold and prevent human exposure and damage to the home. While there are laws or regulations stating that remediation must be done, it is in the potential homeowner's best interest that any mold or problems are remediated. And here are my references. Thank you. Here's my contact information.